sorry, I speak no Japanese. I will do my best, though, and we will have slides that are in Japanese also. I'm honored to be here today to present to you some of the information we have on our high-risk breast program in Hawaii. Our program began here at Kapiolani Women's Center. Our program began in 2005 here at Kapiolani Women's Center. We are the first program in Hawaii that runs a high-risk breast clinic, which is also known as a breast cancer prevention program. The program initially started here on Oahu, and then it moved to the neighbor islands. The progression was we started here, and we then took this program into Kauai at one of our partner hospitals at Wilcox Medical Center, followed by taking this program into Maui, Hilo, Kona, periodically going to Lanai, and twice a year we go to Molokai. The program is actually the first of its kind in Hawaii that provides preventative services for women who are at risk for breast cancer. We will go through the criteria of who meets criteria for a high-risk breast program. The first one, I'm doing this off the top of my head because I don't read Japanese. Let me just refresh myself. Okay, I think I can do it off the top of my head. Go to the Japanese version. The first criteria, and the one that we see the most in this program, is for women who come to us with a strong family history of breast cancer in their family. We see many women whose mother, sisters, daughters, aunties, cousins, all have had breast cancer in the family, and it can be either from their mother's side of the family or their father's side. And so that's the majority of what we see being referred into this clinic. There's also the criteria who's higher risk if you have had a personal history of ovarian cancer or a family history of ovarian cancer. You're also at higher risk for breast cancer, and therefore you are eligible to be in this clinic. We're starting to see more and more of patients being referred in from other doctors here in Hawaii who are coming to us with family histories of known mutations. So the known mutation carrier, meaning there is a gene within the family that had a mutation found, and these are women who are at much higher risks for breast cancer. So we are seeing women coming in who are already identified as a known mutation carrier, or let's say their cousin had a known mutation and they need to be tested. So we're seeing that. The last criteria of what we see that comes to us are women who've had a previous breast biopsy, and that biopsy came back with the surgeon telling the woman, you have a precancer in your breast. It could be atypical hyperplasia or another pathology called lobular carcinoma in situ. These are precancers. They carry a higher risk in and of themselves for having the woman get breast cancer in the future. And these are appropriate women that are followed in a high-risk clinic. I will now go through some of the components of what happens for women who come into our clinics and what we do with those women to help them lower their risk for breast cancer. The first thing that is done is a comprehensive history and physical exam. We look to be sure that we understand what has gone on in the past with each woman, and then we also look at their family history to be sure we understand who in the family has had breast cancer. We take a thorough risk assessment from that. There's a lot of new computer models that look at cancer risk assessment to determine what a woman's risk for breast cancer is. We also look at additional tools that can be offered to evaluate this woman for risk for breast cancer. We start looking at when in the family breast cancers happened. So we look at ages in which their mother or their auntie or their sister had breast cancer, and that determines how soon we start screening that woman for cancer. How soon do we start mammography screening? How soon do we start MRI screening? In general, the younger the woman's family history, you start screening them earlier than age 40. So we look very carefully at the ages in which they had their cancers in their family. Our program uses mammography screening that is usually used once a year, starting for an average woman at age 40, but a high-risk woman can start many times earlier than that. And also, we use an awful lot of MRI screening for breast imaging in addition to mammography screening. So breast MRI and mammograms we're starting to use more and more for very high-risk women in this clinic. We also see a role of breast ultrasound, so we use all of these tools as needed to screen the woman for breast cancer risk. Additional components of our program includes genetic testing and counseling. I know the presentation before me, from what I could gather, was talking about BRCA as some of the genes that we have that we're looking at to see if there's a mutation or a mistake in the gene that would lead us to a much higher incidence in getting breast cancer. A known BRCA gene mutation carrier has got published incidences of getting breast cancer as high as 87%, which is very high. So there's additional imaging guidelines for those women who wish to keep their breasts. And these are also women that you counsel very carefully about preventatively removing their breasts that give you a much greater risk reduction. So we do genetic counseling and testing in this clinic. Other things we do is basically lifestyle counseling, looking at lowering your risk of getting breast cancer through just healthy living, and we'll go through that on one of my slides on some of the things that we want to consider in keeping our risk lowered for breast cancer. So, what are some of the things that we can do to lower our risk for breast cancer? These are a couple of them. I will go through these and then I'll convert it over to the Japanese one. The first one is to avoid obesity. I just see that we were talking about BMI, your body mass index. Ideally, we want to counsel women to try to ideally shoot to have a normal BMI, and that would be looking at your height and weight and determining if you are overweight. We want to get you back into an ideal weight category. Physical activity, I know we also talked about that. It's important for all of us to try to get regular physical activity. That's cardiovascular, defined as about 30 minutes of something that gets your heart and lungs going, about 5 times a week. And it could be jogging, swimming, going to the gym, brisk walking. Any of those would be good activities just to be sure we stay healthy. Nutrition, some of the things we look at is a low-fat, low-sugar diet, high-fat, more whole grain breads and cereals. Also more vegetables and fruits in our diets is also good. It's important to minimize alcohol consumption, or better yet, not drink at all. Smoking is also a risk factor. We are starting to see more and more that leads to breast cancer risk. So we encourage them to not smoke. Also important to try to find ways to minimize stress in our lives. I know I have a lot of women who ask, is stress a risk factor for cancer? Well, you know, you kind of stop and think, well, people who are under a lot of stress have had moments where they feel that they've had cancers happen more frequently, and they are not eating and they're not sleeping as well. So those are things that can be controlled, and it's important for all of us to be able to find mechanisms to have low stress in your life and learn how to manage stress. So lastly, I'll go into how to make a referral into our program. For those of you who live here in the Hawaiian Islands, this program is eligible. You are eligible if you are high risk to be evaluated in this program. Luckily, we have a second nurse practitioner who works with me. Her name is Maneko Kaisho. She speaks very fluent Japanese. I speak no Japanese. She unfortunately is away today on vacation. But we are very able to take care of multilingual patients in this clinic. And we, I think, would be able to service a lot of needs that are there for women who are high risk for breast cancer, whether it's through careful counseling, referral to specialists, a lot of things that can be offered through this program. How this program has been set up is you can be referred by a doctor, by a family doctor. You can be referred by a surgeon. You can be self-referred. We left it very open. And we're believers that women know their family histories many times better than anybody. You know that you've got multiple people in your family who have had breast cancer. So that is why we've allowed this program to be also self-refer, because women know best their history. So I'm happy to stop and see if there's any questions I can try to answer with some Japanese interpretation. Thank you.
すみません。表の中にですね、your prevention item which says nutrition 栄養の中にロー脂肪を推薦されてるんですから、その脂肪ニュートリションやローファットとがんっていうのはこう関係してるんですか？
We feel that higher fat diet can contribute to added cancer risk. Colon cancer in particular is one that they look at as higher fat diets contribute to colon cancer risk, possibly breast cancer risk. So what I usually try to tell women is less fried foods, less red meats, and less dairy, because there's a lot of fat in dairy if you think about butter and sour cream and mayonnaise and whipped cream. So all of those are hidden sources of fat that many of us don't think about, but we eat every day. So to try to change our diet around a bit so it's less high fat, more fruits and vegetables.
ちょうどそのページが出てるんで、気になるんですけど、役が間違ってますよ。その禁煙の場合は自分で気がついたんですけど、多めの穀物間違ってるでしょ。いや、多めの穀物じゃなくて、もうホールグレインだから。ホールグレインって違うね。
多めの穀物で私は書いて栄養の中の1、2、3番目の多めってホールグレインを多く取りましょうという。そ
れを書いてないから。
質問については皆さんの講師とともに一斉にご質問を取りますので、テリーさんの講演はこれで終了させていただきます。